Welcome to the Cutting Edge Convention, a worldwide movement to revolutionize your life. No more stumbling around in the dark, wasting precious weeks, months, and years trying to figure it out on your own. Get ready for valuable innovations and strategies. And now, here's your host, Marcy Peters, the Age Backward Mentor.
Hello, and welcome back to the Cutting Edge Convention. I'm your host, Marcy Peters, the Age Backward Mentor, and I help smart, successful men and women step into a life they love and a body they love being in, and so that they can age backward and avoid traditional aging. And I have another specialist in this area today to introduce you to. We're going to talk about how to look 10 years younger without surgery. And I think for a lot of us, that's of interest. So let me tell you about Dr. Anthony Youn. He is America's holistic plastic surgeon. Dr. Anthony Youn is a board-certified plastic surgeon, best-selling author, and TV personality on Rachel Ray and Dr. Oz. His TV special has been viewed by millions, and he's the author of The Age Fix. He's a member of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgery. Dr. Youn, am I saying it right?
Close, it's Youn, but
Youn.
Very close.
Dr. Youn, Anthony Youn, thank you so much for being here.
Oh, it's my pleasure, thank you.
Good. So thank you for being on the Cutting Edge Convention. Let's jump right into the topic. So today we're talking about how to look 10 years younger without surgery. How did you start, getting into this line of medicine in the first place?
Yeah, so I'm a board certified plastic surgeon. So I went through 4 years of medical school, and finishing medical school, I had, really throughout medical school, I really didn't know what I wanted to do, and eventually came upon the field of plastic surgery. I wrote a book a couple years ago called In Stitches, and it's all about my journey of how I became a plastic surgeon and decided on really that field. And in the end, it was a number of patients, I think, and I think a lot of physicians find this, is that there's a few patients that kind of stand out to them, and those patients kind of inspire them, I think, to go in a certain direction. So for me, there was a patient that was just a terrible situation of a little girl who basically was attacked by a raccoon and had a lot of her face literally mauled off. And to see the plastic surgeons and the things that they were able to and planning to do with this little girl inspired me to go into the field of plastic surgery. And so that's one of the things I wrote about in the book. And then from there, plastic surgery is such a wide field, from pediatric reconstruction to reconstruction of women with breast cancer, to hand surgery, to burn surgery, to cosmetic surgery. I spent a year actually out in Beverly Hills with a big name Beverly Hills plastic surgeon there as a fellowship, and then came back to Michigan, started my own practice. And now I do primarily all cosmetic procedures. And what I've really focused on, especially in the last maybe 8 to 10 years, is how people can hopefully avoid surgery, avoid going under the knife and the risks of that, yet still hopefully get the results and the look and the self-esteem, hopefully the self-image, maybe that's a better way to say it, that they're looking for.
I love that. Thank you. And of course, surgery has its place, and also we're going to talk about what you can do to avoid that. So in looking younger, what's the first place to start? Where do you start with your patients?
Yeah, and this is something that I know you have discussed and other people in the summits have discussed, but food. I mean, food is the number one thing that I think people don't realize can really make a profound impact on how quickly you age and how you look. And so that's something I talk about with my patients is, trying to get on the right type of diet, avoiding sugar, avoiding dairy, avoiding inflammatory foods, because that will prematurely age you. But more than that, then you look at the products that you put on your skin. And then after the products you put on your skin, there are all the various treatments that we can do. And, some of this is all about cutting edge. There's so much cutting edge technology now that is being used in the field of plastic surgery that has allowed us to get these great changes for people, yet not have them go under the knife and go under a general anesthetic and that type of thing.
Okay, great. So we're going to talk about those options. And first, I want to go back to what you mentioned, skincare routine. Well, first you mentioned nutrition and food, and obviously that's really important. So I don't want to gloss over that. And then what about skincare routine?
So I think people, there's so many people, millions and millions of us who have bathrooms that are filled with half-empty lotions and potions and bottles and tubes, because there's so many things out there that promise to make you look 10 years younger. It's better than Botox and all these things, yet most of them don't work. And so I wanted to do, and in my book, The Age Fix, I try to do is give a very simple skincare routine that really anybody can follow that can help you look younger. So it is very important what you do to your skin. And people spend hundreds and thousands of dollars on expensive products that they buy at fancy department stores. And in reality, sometimes you can actually get a better result with a drugstore brand cream or something you can even make at home. And so what I call this, it's a 2-minute, 5 years younger skincare routine. And put simply, you cleanse your skin in the morning and you apply an antioxidant serum like a vitamin C. And that's going to help block the free radical damage that can happen during the day from pollution, the foods you eat, automobile exhaust, that type of thing. And then apply a nice sunscreen to your face. In the evening, you cleanse your skin. Very important, because during the day we get all the day's grime and pollution and these free radicals and dirt that get stuck on our skin, and you have to wash it off at night. So you cleanse at night, and then you apply typically a combination of a moisturizer with an anti-aging serum. And that anti-aging serum or cream, usually the first thing I recommend is a vitamin A derivative like a retinol or retin A. If, however, you have real sensitive skin, sometimes that can cause people to get some irritation and things. If that's the case, then I would go after a growth factor-based cream. So that's all you have to do. In the morning, you cleanse, you apply an antioxidant, you apply a sunscreen, and at night you cleanse, you apply the anti-aging cream. If that's all you do, you're going to be ahead of still 95% of the population.
Okay, so that sounds like a relatively simple routine that most of us can follow. And that would be the same for men or women, right?
Yeah. So the only other thing that I would add to that, if you have time, is to try to exfoliate your skin a couple of times a week. So there are some of, we all have different types of skin. So if you have very sensitive skin, then maybe you only need to exfoliate once a week. If you've got kind of oily, thick skin, then exfoliating a few times a week can definitely be helpful. And what that does, it helps get rid of the upper layer of dead skin cells. So what we find is that when we're young, our skin, a skin cell comes to the surface and sloughs off. The entire life cycle is about 6 to 8 weeks. And that's one reason it's that turnover of skin every 6 to 8 weeks that causes people who are younger to have good, vibrant, youthful, tight, wrinkle-free skin. But as we get older, that slows down. And we start taking 10 weeks, 12 weeks, 14 weeks for that skin to get to the surface and slough off. And because of that, we get this buildup of dead skin cells. It causes our skin to look drier, to lose kind of the vibrance to it. It feels rougher. So by exfoliating your skin, you can actually get it to start turning over more quickly and get it back to that hopefully 6 to 8 week turnaround that we ideally like to see.
Okay, great. And how do you know if you have quality products or what a quality product is? And are there certain things to avoid in a product?
Yeah, so there's a lot of things that you can look for. Unfortunately, what you find when you go to the drugstore and the big companies that make products is that they will add preservatives and additives, things like methylparabens and fragrance, that there can be sensitivities to. You can make your own products at home, and some people do that. I do have some recipes in my book, The Age Fix. Good friend of mine, and I'm sure of yours, Dr. Trevor Cates, just came out with a book, and there's a lot of recipes there for your skin as well. So you can do it at home if you really want to use all natural ingredients, especially if you have a lot of sensitivities. But really, if you want to go and don't want to take the time to do that, then just look at the ingredients. And there are several things you need to watch out for. Once again, fragrance, methylparabens are two of the big ones.
Okay, great. Thank you for making that super easy. So no parabens, no fragrance. That's pretty straightforward. So now let's talk about what are some of the other options, the non-surgical options to also have younger skin.
Yeah, so I tell my patients that short of having really droopy sagging of the skin, like if people lose a lot of weight and they have skin that hangs to their belly, there's no non-surgical option for that. If somebody's got a ton of loose skin of their neck, there's no not good non-surgical option. Whenever you've got a lot of loose hanging skin, unfortunately, the only way to get rid of it is to cut it out. Short of that, though, there are a lot of other options for the issues that we may have. So for example, for people who have some early looseness, let's say of the lower face and the neck, there are laser treatments, and there's one called ultherapy that uses ultrasound that can heat up that deeper skin to get the collagen fibers to actually tighten up. And it's a non-surgical procedure. There is some discomfort because there is some heating to it, and so you do feel that on your skin. But there are people who can get a nice, modest to moderate tightening of the skin that way, and hopefully stave off going under the knife. There are procedures now, and one of the kind of the hottest things in plastic surgery now is how can you get rid of fat without actually dieting and exercising. It used to be, even 5 years ago, we'd say the only way to get rid of fat without dieting and exercising is liposuction. Well, you may have seen liposuction on TV and on videos, and it's a pretty gruesome procedure. We take basically this long metal rod and we attach it to a suction and literally just stab the person over and over again until that fat is sucked out. So it is a pretty gruesome procedure that can have discomfort, bruising, pain, bleeding, and that type of thing. The great thing, though, is that we have now discovered ways to actually destroy fat cells without having surgery. And there's a number of different products that do it. Probably the granddaddy of them all is called cool sculpting. And this is a device that just attaches to the outside of your skin, and it will literally freeze those fat cells. And the crazy thing about that is that they initially got this idea because there was a little kid who kept sucking on, not lollipops, but like popsicles. Frozen popsicles. Yes, popsicles. I don't know why I can't think of that term. But he kept sucking on these popsicles, and the doctor, or I think that was the patient's dad, found that he had an indent in his cheek. And it was where that popsicle was always at, and figured out that the actual cold damaged those fat cells to such an extent that the fat cells were actually cleared by the body naturally. So they took that idea and developed this device that you can attach to the tummy, to the love handles, even have it for the double chin area, and it will actually freeze that fat but leave the skin undamaged, because the skin can actually tolerate the extreme temperatures much better than the fat. Within about 2 to 4 months, your body gets rid of that fat by natural mechanisms, and that area has lost like 25 to 30% of the thickness of the fat.
Oh, wow. Okay. So cool sculpt, and can that be used anywhere on the body or just certain spots?
It can be used on most areas, and there's a number of other ones now since cool sculpting has been out that seem to work real well too. There's one called Sculpture that uses a laser to target those fat cells. There's another one called Ultra Shape Power. That's probably the newest one now, and that can actually target the fat using ultrasound. So it's that same technology that you can put on a pregnant woman's tummy and look at a baby. You can take that ultrasound, turn those waves way up, and you can actually blast those fat cells. And that so far has had the most percentage of studies of fat reduction of like 30 to 35% reduction of fat after just a couple of treatments. And there's typically no pain or downtime associated with it at all. So I said before on certain interviews that the holy grail of plastic surgery is how do you get rid of fat without having surgery or getting injected or anything like that, and we've actually achieved it.
And are these procedures lasting? Do the results last?
And they actually do. Because those fat cells are destroyed, they don't necessarily grow back. Now, then people may say, well, okay, well, what if I start eating a lot and I stop exercising? Is that fat going to, can I gain weight? Of course you can. So the fat cells are destroyed, they're removed, like with liposuction, where they're physically actually removed from the body. But depending on your lifestyle, the fat cells that are left behind can enlarge. So you can still grow back. So it's not an excuse to say, okay, now I'm going to eat whatever I want.
Right.
But it really can permanently get rid of. And it really is good for those people to say, look, I watch what I eat. I eat a good, nutritious, healthy diet. I exercise regularly. Yet for some reason, I can't get rid of my saddlebags, or I can't get rid of my love handles. No matter what I do, this is the type of treatment for that.
Right, because some people, we all have different shapes and sizes that we're genetically inclined to. And
Exactly.
Like you said, even if you've lost weight and there's really no excess weight, certain things can be something that you might want to change. So it sounds like this would be a good option for that.
Yeah, so I mean, it always starts with the food that you eat. And, I see, really it's interesting because I have patients come in and I'll see, 30 patients a day. And a lot of times just when they sit down across from me, I can have a pretty good idea of what their diet is and the type of food they're eating just by looking at their skin. So what you eat can have a profound impact. What you put on your skin can really reverse aging if you use the right products. And then once again, there are all these other ways that we can kind of target aging that don't involve surgery. And so interestingly enough, the number of people who are undergoing cosmetic procedures that are minimally invasive or non-invasive is skyrocketing. But the number of people undergoing actual surgery is staying just about the same.
Oh, okay. That's interesting. Okay, so we covered nutrition and food, which is obviously a foundational piece that can't be left out. And then we covered the skincare routine for the face. That's really important. And then these other procedures outside of liposuction. What are some other things that are going on in your world?
There's a number of other things that we're working on. Like I said, the skin tightening, I think, is really big right now. And I joke that if I could develop a device that looks like a CAT scan, but instead of radiating and to try to get images of the body, it's a laser that tightens up all the skin of the body, and we could just run people through it, that I'd make a mint doing that. That's all I would do. Unfortunately, we don't have that, but there are devices now, like the L-Therapy device, that we're getting to be able to tighten up skin without downtime. The other thing that's becoming really popular now as well are various injectable treatments. And one really good one that has been a way for us to also prevent people from going under the knife is called Kybella. And Kybella basically is a naturally occurring, it's made of deoxycholic acid, which is a naturally occurring substance in our GI tract that basically emulsifies and absorbs fat. And so that substance has been purified, it's FDA approved, and if you inject it into areas of fat, you can actually melt that fat away. And so where it's FDA approved for right now is the double chin. So it's a really easy to undergo treatment. It takes maybe a half hour. Typically anywhere from 2 to 4 treatments are needed, but it's a great way for those people to say, look, I've got this double chin that I inherited from my mom or my dad. It makes me feel heavier. It makes me look heavier than I really am. And it's a great way for us to be able to reduce that, get a better profile, and get people feeling more confident, yet not necessarily putting them under the knife, giving them scars, giving them anesthesia for liposuction.
Okay, that's great. So I'm curious, Dr. Youn, if you've looked at cost analysis, if you actually said, well, for the person to get the same results as lipo, they would need 12 sessions of this other thing, or 6 sessions of this, 6 sessions of that. How does it normally turn out cost-wise, or have you looked at that?
Yeah, and that's, the one thing, that Kybella is great and it works really well, but it depends on how much fat you have. And so if you're the type of person that just has a small area here and you're, let's say, a busy working, and for you to take time off is going to cost you a lot of money, then it may actually be worth your while to do Kybella. However, let's say you walk in the door and you've got a lot more here, and for you to take time off, that's, it's not as big of a deal. Let's say you've accumulated 6 weeks of time off, and hey, you got to find something to do with it anyway. Then for that type of person, sometimes doing liposuction may be a better option for them, because they're going to get an immediate change. They're going to potentially save some money and time, and they won't have to worry about going to work the next day and that type of thing. So yes, we do look at it as a cost-benefit type of thing. The big negative that I find, and we do a lot of injections of filler. So the basic filler is people's own fat, and then years ago we were using collagen. Now we're using all these hyaluronic acid-based fillers. And the best way to describe it, if any of your audience has never heard of fillers or don't know exactly what they are, it's like synthetic skin. And it's like liquid skin, and you can inject this substance into, let's say, wrinkles are called the nasolabial folds, into the marionette lines, which are the wrinkles down here, even into the lips, and we can even inject it to plump up the cheeks as a way to kind of add volume and fill in lines. The problem with fillers is that they're really expensive, and they cost at minimum about $500 per syringe, and most of the time you'll need more than one syringe, and so it gets costly. They are temporary. They can last a year, sometimes longer, but I wish that with all these fillers that we're getting now, if the manufacturer just brought the cost down, it would make it so much more affordable to more people.
Yeah, yeah. So I'm curious, you have great looking skin. Have you tried any of these procedures yourself? Do you experiment with it to see what it's like?
Yeah, so I think for me, it's kind of that kind of threefold thing. So the first thing, once again, trying to eat a good diet, trying to avoid all those things that are terrible for your skin. Second thing is every morning and every evening, I do that 2-minute skincare routine. I'm a guy, and like most guys, I don't want to spend 15 minutes in the morning putting all these lotions and potions on my face. So I'll do that 2-minute skincare routine. And I will vary it occasionally depending on what I need to do and what I'm seeing. And sometimes I'll add things like there's products called that have like niacinamide in it, and that can help to lighten up some of the skin blemishes, that type of thing. But I do that, and I have had some treatments. We have one treatment in my office called it's called IPL, and IPL is great for dark spots. So if you're looking at good bang for your buck, if you're the type of person you say, look, I don't like putting all these stuff on all the creams on my face. I want to see a result very quickly. IPL is short for intense pulse light. And this is a great bang for your buck because number one, there's no downtime with it. Number two, there's almost no pain or anything with it. And number three, you can get results within a week where you can literally, if you've got age spots, sunspots, liver spots, all the different names for the same condition. If you've got those and you want to get rid of them, and a lot of these IPL devices, you can get rid of them, literally a good amount of them within 1 week after the treatment. Literally, you'll see those dark spots fall off. And so typically those treatments are not more than a couple $100s. It's still expensive for some people, but when you consider the cost of surgery and stuff, it's not so bad.
Yeah. I've done IPL. I've tried it. It works. It definitely works. And it's a great maintenance thing too, after you do a couple initially, to do every so often, I've found. What about Fraxel? Are you doing Fraxel?
I don't have Fraxel. Fraxel basically is a fractional laser. I do refer people out for it. The way that works basically, and the way almost all lasers and heat-based devices work, is that if you heat the deeper layer of collagen of your skin, you can cause it, if you get it up to a certain temperature, which is on the outside skin is technically about 42 degrees centigrade. You bring it up to that temperature, the collagen will actually denature, and when it heals into a tighter fibers, okay, tighter packed fashion, and that will cause your skin to tighten. All of the laser treatments that are used to tighten up your skin, radio frequency treatments, even the ultrasound treatments, are all based off that same idea. If you get the temperature to a certain level, the skin will tighten. Now, back in the day, when all we had were the CO2, we call ablative lasers, we could try to get that heat to the deeper skin, but to get there, we'd have to burn all the surface of the skin to get there, which is quite horrific because literally you burn the whole surface of the skin to get that heat to the deep skin. You exfoliate that skin so it grows back eventually, and people get a lot tighter. But the problem is that recovery was horrific. I mean, people said, I'd rather have a facelift than undergo another one of these laser treatments. So Fraxel was the first one, and still kind of the state-of-the-art one, for a fractional laser. So instead of burning all the skin off your face, you burn a fraction of the skin, okay? So it's got little small dots that you burn, and so the skin that's around it is still unburned, and so you can get a nice improvement there, but you don't have quite the downtime. And that's a great way to rejuvenate the skin, to tighten the skin, and to even reduce fine lines and wrinkles without having to get this horrific kind of ablative laser resurfacing that people used to do.
Okay. And I'm just curious if there's a reason why you don't offer that in your office?
I don't offer it in my office just because I don't have time to do it, honestly.
Okay.
And the device, literally these laser devices are hundreds of thousands of dollars. Some of them can be, they start really at about 80 to 90,000 and go up. And so for you to pay it off, you really have to do a lot of these procedures. And, that type of laser is very powerful, and I would really only trust myself with it. But I'm too busy, honestly, doing a lot of other things that if I bought that laser, I'd lose money. So I do send those types of patients who I think are good candidates to a colleague of mine down the street, and they typically get a nice result. One other caveat for those of you who are watching and listening, and you say, okay, I'm looking for a good bang for my buck, and wow, laser treatments, they can be very expensive. A fractional laser treatment can be thousands of dollars. Yeah. But you can get a fairly similar result if you do chemical peels instead. And it's a very simple idea, okay? Chemical peels will exfoliate and tighten the skin using the acid. So it's all about damage, controlled damage, and the skin heals back in a tighter fashion. For me to buy a TCA chemical peel, the cost of that on one patient may be $10 to $20. However, the cost per treatment of a laser, when you take in the cost of the actual device, could be hundreds and hundreds of dollars. So you know that cost is going to be passed off onto you, the consumer. And that's one reason why laser treatments cost so much, is because the devices are so expensive. So if you're watching and you say, look, I would love to tighten my skin, I'd love to exfoliate my skin, but I don't want to spend $1,000 on a fractional laser, consider doing a moderate depth like a TCA chemical peel, because you can usually get that much less than $1,000 and get a fairly similar result and spend a lot less money.
Okay, great. So many good ideas. Thank you so much. Is there anything we haven't covered?
I mean, there's so much out there. On my website, there's a couple of free gifts that I give out if you sign up for our free e-newsletter, and it's all about tips, tricks, and secrets. So there's 10 secrets every plastic surgery patient must know. There's a nice ebook there, as well as an ebook about what to eat to look younger. So there's so many tips I give. I do a Facebook Live sessions. I have a podcast. And there's so many ways for us to disseminate it. So I encourage you, take a peek. And if you've got specific things you're looking for, let me know. Tonight, and I know this is going to air a little later, but I'm doing a Facebook Live where we're talking about embarrassing beauty treatments and how to treat it. So for example, and this is something that isn't something that makes you look better, but chronic bad breath. Okay, this affects millions of people. And we all have friends of ours who have that kind of dragon breath. Now, they may brush their teeth, they may floss, they may use mouthwash, yet still their breath isn't so good. And we think that in a good percentage of people, it's because of bacteria way, way on the back of your tongue. So scientists and dentists have actually found that if you combine a specialized tongue scraper, okay, you literally pull your tongue out and you scrape the back of your tongue, and then you rinse with chlorine dioxide, special mouth rinse. There's one brand called ProFresh. I have no relationship with the company or anything like that. But you combine that, and upwards of 98 to 99% of people with bad breath will actually get it cleared. So just a nice little trick. If you're one of those people, it definitely works. We've got solutions also for excess sweating in the armpits. There's a 100% works, and actually works probably about 92% of patients where those people who keep sweating from the armpits, even when it's cold outside, we've got solutions for that don't involve surgery, and they work.
That's so great. Well, okay, so this is an ongoing conversation, obviously.
Oh, yeah. There's so much out there, and I'm happy to share.
Okay, wonderful. So I'm going to have a link for everyone to get their free gift that Dr. Youn mentioned, and so pop over there, do that, and then you'll also have the opportunity to join these Facebook Lives and podcasts and stay part of the conversation and ask questions and be interactive and so forth. Dr. Youn, thank you so much for sharing your tips and secrets. And I also want to encourage everyone to get the Age Fix, his book. I'm going to have a link for that as well, because then you have the opportunity to make those products at home, the homemade products that you mentioned, and then go through that routine and whatever else we didn't cover in this interview.
And there is a special on the website. If you get it through our website, it's $10 off the cover price, and we give 4 free gifts. So a bonus chapter that you can only get, through that. So there's so much out there. I have so much I'd love to share it, but it really is a pleasure. I thank you so much for inviting me to be in your summit.
Yes, thank you so much, Dr. Youn. So Dr. Anthony Youn, thank you for being on the Cutting Edge Convention. And to everyone who joined us today, I hope you got some really good tips and secrets. I know I did, and I wrote down a few notes, and I'll be doing some follow-up stuff as well. So have an amazing, happy, healthy day, and I'll see you again soon for the next presentation. Bye.
Thank you for being part of the Cutting Edge Convention. We don't want you to miss a single valuable session. To have the entire event available to you at any time, purchase the package now before the event ends. That's when the price goes up. And watch your emails to get your next steps from Marcy.